Yeah. So they asked me to speak about my injuries, and it's like, so there's no, when they, obviously circumcision, so there's a scar running around the circumference of my penis, but there's no cut here line when they, everything that goes under the clamp gets cut off. So when the doctor rips the foreskin off of the head of the penis of an infant and then inserts the Gonco clamp, which is the most common clamp style they use. So everything that gets clamped off gets cut off. So when they cut my foreskin off, which is part of my penis, when they cut part of my penis off, they cut so much skin I had what was called a buried penis. So my penis barely stuck out of the skin. So they talk about, oh, a little boy's going to be embarrassed if he's in the locker room with his foreskin. How about having no penis? How does that make a child feel? And so it's like, I grew up like that. I was well into my 20s before it even protruded at all. And even today, it's like, when I do have an erection, it's very uncomfortable because there's not I have what they call a scrotal fusion. So that's part of the scrotal skin actually comes up and tries to cover the fetus because there's not enough skin involved. But all of those physical injuries are nothing compared to the psychological damage that was done to me. And it's like, I think it's probably fortunate for the little boys that do immediately go into shock. That's probably the best thing that can happen to them. It's hard to say the best thing can happen to a newborn infant, then it goes into shock. But so the psychological damage was done for me. That was our organ of reproduction. So my first experiences in life was getting strapped down and having part of my genitals amputated with no anesthesia and no painkiller. And yes, today they use painkiller, but is it effective? Do they wait long enough for it to be effective? Was it the dose proper? Did they ask the child if the dosing is proper? No adult is going to sit idly by with a local anesthetic for an amputation. They don't give anesthesia to an infant, especially a neonatal infant, except in extreme emergencies. And this is the most common surgery in the United States is circumcision. And circumcision is a euphemism, but it's just a word they've created so that they don't have to call it genital mutilation. It's female genital mutilation, male genital mutilation. It's all the same.